We'd like to welcome you both to the program.
Thank you.
Thank you.
All right, glad to have you. Let's begin with you, Dr. Jibade. It's more and more cases we're seeing as people are trying to get back to their lives, to the normal. How would you say we're managing things here in Nigeria?
Well, I got to say, and thank you for having me on, I've got to say it's been quite gratifying that we haven't had it as badly as the rest of the world, the Western world in particular. People are getting back into work and, of course, trying to keep social distancing, and, of course, the government is playing its part. So I would say that we've done a lot better than most other places, especially the United States.
Let's come to you, Dr. Ogunyemi, and that is with what's happening in Lagos. Lagos is still witnessing, tons of cases, and we were warned that we're going to see 200 to 300, projected every day.
So, well, in Lagos, it's the center of excellence, and the population in Lagos is actually quite large. So if you're looking at other states, if they're having one case, we will probably be having 10 cases. You also have to bear in mind the fact that in Lagos, it's a bit difficult to actually obtain the social distancing, directive. Be that as it may, I know people are trying their best, especially to keep up with the mask. At least you see, well, not everyone, but at least if you line up like 10 people, probably 6 out of the 10 will try to put on their mask, even if it's not effectively worn, but be that as it may, I think people are just happy to be back out there to be able to get on with their lives.
You're right. Let's get back to Dr. Ajibade, and I'd like to draw your attention to some of the revelations by the NCDC DG yesterday, talking about a new study that the longest viability period of the coronavirus is 10 days. I mean, this apparently changes a lot of things, especially looking at our case management system.
Yes, we used to think it was 3 days maximum, and that's for hard surfaces and in the air for minutes to 2 hours. But this really changes a lot of things, which again emphasizes the importance of hygiene and practicing all the habits, all the practices that the government and other experts have told us about. So no, you cannot be relaxed or laxed on this. As there were people wearing gloves, that's another good example. People would use a glove and they use it the whole day. In fact, when we were miking up, I was asking them if it was the gloves they were using to mic me up was new. I said, was I the first person they were using for? And they said yes, because the truth is, these viruses can stay and endure for much longer than we had expected before. So it still underlies the importance of really paying heed to the instructions and the warnings that are going on, because it is not over yet. We've been lucky, we've been fortunate, the government has worked very well, but it's not over yet.
Dr. Ogunyemi, in terms of Lagos and the fact that we're working at home-based care, for example, now that also helps with regards to the number of people we can discharge faster and freeing up more spaces for others.
Yeah, well, the home-based care is still in the offing. It's not yet out there, to be actually practiced. Though, of course, it's a possibility. And that's because the isolation centers, they're filled to the brain. Okay, and yet we still need to take care of people to ensure that we don't record more mortality. So for the home-based care, recently we talked about, we've looked at the cases that are in the isolation centers, the number of patients that are likely to die, and we've been able to kind of fashion out a percentage. So averagely, we expect that 5% of people who are infected would be really bad, okay? But over 80 to 85% of them will be mild cases. So when we're looking at the home-based care, we're looking at mild cases being managed at home. Mild cases are people who probably don't have symptoms at all, or probably they just have a little bit of a fever, but there are cases that do not need, intensive care, so to say. So in such cases, we might be able to manage such people at home, okay? But then a lot of caution in home-based care, because if the patient is being managed at home, if you do not practice self-isolation, ideally as it should be practiced, we're looking at affecting other household members. And those household members are not under self-isolation, and then they're still going to go out. And then we'll still have, the cascade of infection going on. So a lot of caution on home-based care. But at the end of the day, if we're not able to achieve, taking in people into isolation centers, it might be a way forward.
Dr. Jibade, bringing you in here, and this is with regards to what's happening in your practice, perhaps in the Federal Capital Territory there, with regards to the number of outpatient visits that are coming in. The last information we got was that that number has since dropped, and that we still have healthcare practitioners, workers who are still skeptical about handling cases coming to the hospital.
Yeah, that's still a concern because for a while here in Abuja, it was quite intense, and quite a few of us actually tested positive for the virus, and so there was this conflict really as to whether how far you should go in working with patients without PPEs, protective equipment. So, but now it's kind of eased off, but there's still a lot of need for caution. We know that many of the cases, the most severe cases, are among the elderly, the obese, and those who have an underlying condition. And the top four are hypertension and cardiovascular disease, lung disease, diabetes, and I'm trying to remember what the fourth one is. Anyway, there are four of them that we keep on seeing over and over and over again. Okay. And what we've found out is that the underlying factor in most of these conditions is a dysregulated, dysfunctional immune system. And that could be from the disease, it could be from other interplays, the drugs and all the things that they're going through. So it's very, very important that we found out that in addition to medication and the standard palliatives for the body, it's very, very important for the disease, very, very important that we do the necessary things to strengthen the immune system. And that could include some simple common sense advice like going out and exercising more, breathing more. It includes taking what we now know, and we have established studies that show that things as simple as vitamin D can significantly, blunt the response. Because what we know is that it's the body. In those cases, most cases that patients die, it's the body, the immune system, a dysfunctional immune system that does the damage and kills the patient, not the virus itself. Now, the virus does trigger the event, and of course, not to negate what the virus does, it does trigger a lot of damage. But for those who lose their lives, for the most part, the data suggests that it's the immune system that is attacking the body and doing the damage. And so it's also very important as we're looking for drugs and we're looking for vaccines and even the herbal remedies. It's also important that the basics shall always remain the basics. And we know that things like
Dr. Jibade, I wish we had more time, but I'm just being told that we need to go. But we'd like to thank you. Thank you so much, Dr. Daya Jibade, a public health physician. And I'm also certain you agree with a number of things he said. We appreciate your time on the program. Dr. Rike Ogunyemi, thank you for joining us.
Thank you. Always a pleasure.